Hello, my name is Valerie and I'm one of the nurses for Dr. Anne Clark at Fertility First, and today I'm going to show you how to use Pregnyl injections. This video is to show you how to inject Pregnyl 1500 units. Pregnyl 1500 is used as supporting or follow-up injections for most of our cycles. You'll need your 3mm syringe and two different needles, an 18 gauge drawing up needle which is blunt, and the little 27 gauge needle which you will inject with. Open the syringe and fix the blunt 18 gauge needle onto the end of the syringe, like so. When it comes to the Pregnyl ampules, these need to be cracked open. They all have a little black dot on the top half of the ampule, and that is where you have to put your thumb when you open the ampule. With the bottle of water, sometimes water gets trapped up in the top section of the ampule, so you'll need to make sure that that water is down below the neck of the bottle before you open it. To do this, you can either give it a few flicks like that, or you can give it a few swirls, and the water then should be down underneath. You won't have that problem with the powder, it's usually down the bottom of the ampule. Okay. Now, thumb needs to go directly over the dot. You need to put all your pressure where that dot is, otherwise the ampule won't open correctly. Hold the ampule in one hand, placing your thumb over the dot. You're now going to crack the ampule away from you, like so. Okay. You can put the top into the sharps container, and you will do exactly the same with the ampule of powder. Hold the ampule in one hand, your thumb goes right over the dot, and you will crack it open away from you. Thumb and away. Okay? Get rid of the top. Once the tops are off the ampules, you're going to need to withdraw the fluid and squirt it into the powder ampule. So to do this, with your big 18 gauge drawing up needle, just put it into the bottle of the solvent, pull back on the plunger and withdraw all of the fluid. There are 1 ml in all of the solvent ampules. So the needle is long enough to reach to the end of the ampule, so just put it in and pull back till all the contents are withdrawn. Same needle, same syringe. You're now going to squirt the fluid directly onto the powder in the other ampule. Okay. Once you do this, the powder will instantly dissolve. You aren't going to need to shake it. It will instantly look like water as soon as the solvent hits the powder. Again, with the same needle and syringe, you're going to withdraw all of the dissolved fluid back into your syringe. Again, the needle's nice and long enough to reach into the ends of the ampule. So now you'll have two empty ampules and your mixed solution is inside the syringe. If there's any air bubbles from that mixing procedure, which you can get sometimes, you'll just need to tap or flick the barrel of the syringe to get rid of the air bubbles, and then you're going to just slowly get rid of the air in the top of the syringe. And to do that, with the needle pointing upwards, just slowly push on the plunger and you'll see the fluid level rise. And when you get to the top of the syringe, you'll find that the black plunger should be in line with the 1 ml mark on your syringe. Again, if there's a few little air bubbles that you want to get rid of them, just give it a few little flicks like that and they will rise to the top. You'll need to put the top on your syringe, on your needle, to remove it. It twists off. Then you're going to grab your 27 gauge injecting needle, which just pushes on to the end. And now you're ready to inject. To give yourself an injection of Pregnyl 10,000 units, you will need 2 boxes of Pregnyl 5,000 units. Each box contains 1 ampule of solvent and 1 ampule of fluid. What you're going to need is 1 bottle of solvent, but you will need both the bottles of powder. Okay, so you can get rid of that spare bottle of solvent. Okay, so you'll need to prepare your Pregnyl ampules by cracking the tops off the ampules. So just to recap, you need to put your thumb over the black dot so that you can crack it cleanly. So you're going to hold the ampule in one hand, thumb right over the dot and crack the ampule away from you. Thumb over the dot, crack. So it should come off cleanly like so. Pop the top into your sharps container. 3mm syringe and the big 18 gauge drawing up needle. Okay. Grab your ampule of fluid, into the ampule and withdraw all of the fluid. You'll have 1 ml in your syringe because that is what the solvents contain, 1 ml. You're now going to squirt that fluid into the first bottle of powder, the first bottle of Pregnyl 5000. Slowly squirt the solvent into the powder ampule. The powder will instantly dissolve. With the same needle and syringe, withdraw that injection. But this is only 5,000 units and you will need 10,000 units. So get your second bottle of powder, top cracked off, and you're going to inject your made up solution straight into the second bottle of powder. So what you're doing now is mixing 5,000 units with another 5,000 units, and that's how you get 10,000 units. Withdraw the injected solution, okay, back into your syringe. You will still only have 1 ml in your syringe because you've only used 1 bottle of solvent. You'll see that there's a few air bubbles from doing that mixing and remixing, so just give the syringe a few taps, flick it like that until those air bubbles dissolve. Okay. Push the excess air out with the needle facing upwards so that you don't lose any fluid through the top that you don't want. And just push it to the hilt until the fluid starts to rise through the hub of the needle, and you will see that the plunger line is in line with the 1 ml mark. So what you've got is 2 bottles of powder with 1 bottle of solvent, which has given you 10,000 units. So again, place the cap on the big needle, get rid of it, and put your little 27 gauge injecting needle on and inject into the tummy as shown previously. If you need to inject a lower dose, sometimes we request that you only inject 0.8 of a ml. If that is the case, before you put your little needle on, stand over the sink and just slowly, with the needle pointing upwards, push on the plunger so that you get rid of a small amount of fluid. You will then have in your syringe 0.8 of a ml. Each of the little marks are 0.1 of a ml. So there's 0.5, 0.6, 0.7 and 0.8. So I'm just going to push that a little bit further. Just there we go. So now your black plunger is in line with the 0.8 of a ml mark. And now you're ready to inject. So you'll put the little cap, the little needle on, ready to inject. To inject, you need to grab some of the subcutaneous fat on your abdomen. We recommend that you avoid directly below the belly button line, so either side where you can grab a handful of flesh. If you have a freckle or a scar, then you need to avoid that area, but where you've got some clean flesh, then just grab one of your swabs. You will give your tummy a wipe. Holding the pinch with your thumb and your forefinger, you are going to put the needle on the tip of the skin and then push it all the way in. to inject, you just need to push down on the plunger, and we recommend that you count to 5 as you do the injection. 1, 2, 3, 4, 5. Just nice and slow. The plunger will reach the end of the syringe. We also recommend that you hold it in there for another 5 seconds. Then you can take the injection out, let go of your skin, drop the whole syringe and the needle into your sharps container, and that's it.